Good afternoon and welcome to the Health Shift. I'm Janae Talbot, Director of Public Relations here at Russell Regional Hospital, and I'm joined today with Dr. Somers from our Physicians Clinic. We're going to talk about wound care and our wound care clinic, how you can work with wound care and the benefits. So first of all, welcome Dr. Somers. We appreciate it.
Yeah, it's great being here.
Great, thank you. Tell us a little bit about wound care.
Yeah, so wound care is a new kind of field in medicine, at least in regards to our exposure and our knowledge of it. It's definitely become more prominent over the last 20 years compared to other fields in medicine that have been available and around for centuries at this point, honestly. Wound care was kind of noted because as our population ages, we've noticed that there is a hard time with people healing wounds and getting these chronic kind of wounds. It kind of began primarily as a issue with pressure ulcers more than anything else, but it's evolved into this kind of multifaceted level of care that kind of looks at different types and styles of wounds and tries to do the best that they can to address the problems and help improve wound healing. So.
Why did Russell Regional Hospital look at this as a sector to expand into?
Yeah, so it was actually something that was brought to my attention by a previous director that we had here of surgery, stating that it was something that was needed in the area that we really didn't have. We were noticing that we had people with decubitus pressure ulcers, people with venous stasis ulcers, pressure ulcers that were just having to go over to Hayes for care, and we said this is care that we can provide easily here at Russell Regional Hospital, and we want to be able to do such. So with a little bit of training and a wonderful program through Restorix, which is a partner that we work with here in Russell Regional Hospital. We were able to get that training and get staff here to provide the service, which I luckily get to do, and I'm very happy to get to do that.
What days does the service happen?
So I currently do it on Thursday mornings. We start at about 8 o'clock in the morning and we go until around noon, though if we're busy we can expand and stretch that and hopefully make it so it's a full day service if we need to. It's available at the specialty clinic here at Russell Regional Hospital, which is the spot where the old clinic was on the south side of the facility. It's currently the location where Dr. Anderson, our orthopedic doctors and everyone else comes in to kind of provide alternative care. So it's where I work at with wound care.
And how do the patients access the service? Go ahead.
Yeah, so the easiest way to get in with wound care is to talk with your doctor if you have a chronic wound. We do require a referral to be seen, and so if you talk with your healthcare provider and say, hey, I've got this wound, I would like to have it looked at by our wound care specialist team here in Russell, they can get a referral sent over to the company that we work with, Restorix, and can get you scheduled to see me in wound care where we can start addressing and managing your wound care.
If they're not a patient here at Russell Regional or work with a provider here, can they still get scheduled to come see us at the wound care clinic?
Yeah, absolutely.
Okay.
In fact, that's where we get a lot of our referrals besides, the ones that are here locally. I've taken care of people in Osborne, from Ellsworth, from other providers that send us referrals. You don't have to be connected or affiliated with a provider at Russell Regional Hospital to be seen by our wound care specialty team here. We would be more than glad to take anybody and everybody from the local area that would like to make a trip to Russell and see us.
Any additional details about the service or anything that was really unique about it that you've seen so far?
Oh man, there's been so many things about wound care that have been great. So it's a unique service in the fact that there's a lot more hands-on care than most other things that I've done. We normally do serial treatments of a wound, whether that's by going in and cleaning out wounds, whether it's by applying specialty dressings. It's a very interesting service. We're offering newer and expanding kind of more care in the dressings that we provide. In fact, one of the next ones that we should have here within the next month or so is one called Kerecis, which is a medication that uses dedicated fish flakes for treatment, which helps kind of increase the bond of new skin forming and works very effectively and rapidly for wound healing. So we're expanding our services constantly, always looking for new ways to help heal out wounds quicker. So yeah, there's a lot of different options available at Russell Regional Hospital for our specialty wound care team, and hopefully we can get to see you.
As a physician and our chief of staff, you keep very busy, obviously. Is this something that you enjoy doing? Is this kind of change up your day a little bit when you get to do the wound care clinic?
Yeah, absolutely. Yeah, I do still provide round-the-clock care, honestly, for our hospitalist team here at Russell Regional Hospital, and then I have a very busy clinic over at the physicians clinic also, where I take care of outpatient medicine. So this is kind of a completely change in what I do, and I absolutely love it. I tell often my patients that when the time comes to retire, which hopefully is years and years and years later, I'll probably move over to doing wound care and do that more kind of part-time after a lot of time has passed. I'm still very busy here in Russell and plan on being here in Russell for a very, very, very long time.
But it's always good to have that succession plan and that long-term goal.
Absolutely.
Sure.
Absolutely.
Anything else you'd like to share with us today?
I would just say if you have any concerns about a wound that you might have, if there's something that you're not sure of, please come see us over at Russell Regional Hospital with our specialty wound care team. We have wonderful nurses. I hope we have a good doctor that's going to take care of you. And hopefully we can see you soon.
Thank you.
Thank you.
Thank you for watching today.